right. Welcome, bienvenidos, and welcome. This seminar will be offered in English with a Spanish translation. Las personas que deseen escuchar la versión en español, por favor, elegir el idioma oprimiendo el botón en forma de círculo donde dice español en la parte inferior de la pantalla. So, bienvenidos and welcome. We are so happy that you could join us today for the first of 10 monthly webinars we will be holding this year for our Equity and Justice Focused Integrated Behavioral Health Project. My name is Dr. Tiffany O'Shaughnessy, and I am working alongside Drs. Julie Chronister and Molly Schreer in the Department of Counseling at SF State to help meet the behavioral health workforce needs in California with culturally responsive and humble care. Our graduate assistant helping us run this show more smoothly today is Christina Cavilas, and she's going to be monitoring our chat and helping to answer any of those things that we need. So please reach out if you need anything. I'm going to do a few important announcements before introducing you to our distinguished speaker for the day. Let's see. So the first announcement that I need to do is that this webinar today is brought to you free of charge and is supported by the Health Resources and Services Administration so that's HRSA of the U.S. Department of Health and Human Services, as part of an award totaling $1.9 million with 0% finance with non-governmental sources. The contents are those of the author and do not necessarily represent the official views nor an endorsement by HRSA, HHS, or the US government. You can learn more about our project at the website ibhequity.sfsu.edu. So that's the first official announcement. The second housekeeping piece is that if you are one of our HRSA stipend recipients, or if you are interested in receiving continuing education units for your attendance today, please pay close attention to the chat. There are announcements in there. There's going to be a sign-in and evaluation links. The sign-in coming your way now, evaluation links at the end of our session. And then finally, last housekeeping piece, there will be a little time at the end for a moderated question and answer session. So please do use the Q&A feature of this webinar to submit your questions throughout the session, and we will be able to follow up with you then. So I believe that is all of the housekeeping, and now I can introduce you. Our webinar topic today is Liberatory Approaches to Integrated Behavioral Health, and I am so delighted to introduce you to Dr. Leandra Clark-Harvey. Dr. Clark-Harvey is a psychologist and the Chief Executive Officer of the California Council of Community Behavioral Health Agencies, a statewide advocacy organization representing mental health and substance use disorder nonprofit agencies that collectively serve over 750,000 Californians annually. She is also the executive director of the California Access Coalition, a group of advocacy organizations and pharmaceutical industry companies that advocates for patient access to behavioral health treatment. Dr. Clark-Harvey has previously served as chief consultant to the California State Assembly Committee on Business and Professions, principal consultant to the Senate Committee on Business, Professions and Economic Development, and a health policy consultant to the office of former Senator Curran D. Price Jr. Prior to her work with the California legislature, she completed her PhD in counseling psychology at the University of Wisconsin-Madison. She completed her predoctoral fellowship at the University of Southern California Children's Hospital in LA and a postdoctoral fellowship at the UCLA Mattel Children's Hospital. Dr. Clark-Harvey has maintained an impressive record of leadership, including serving on national and local boards, including the American Psychological Association, and prior positions on the Association of Black Psychologists, Sacramento County Public Health Advisory Board, and the Sacramento County Children's Coalition. Dr. Clark-Harvey has received numerous local and national awards, and in 2020 was appointed by California Governor Gavin Newsom to his Master Plan on Aging Advisory Committee and the Behavioral Health Task Force. In 2021, she was appointed by California Lieutenant Governor Eleni Kounalakis to the California Institute for Regenerative Medicine Board. So welcome, Dr. Clark-Harvey. We are so eager to learn from your wisdom, and as always, I continue to be so inspired by you.
Thank you. Thank you for that kind introduction. Very flattering. I'm like, who is she talking about? I'm just living. So thank you for that, Tiffany. I really appreciate it. I'm going to pull up my slides here so that we can start our day together. All right. I hope everyone can see that. All right. So Let's get going here. So I'm Dr. Leandra Clark-Harvey, and I'm really excited just to be here with you all today. And September is actually, this month is about a lot of celebration in the behavioral health arena. So it's National Recovery Month. It's which really honors those who are sober and clean. So we definitely want to give a shout out to all of those individuals and the people that work with them in their recovery journey. It's the Suicide Awareness Month. It's Latino Heritage Month, and it's Labor Day was this month. And during this pandemic, we know that so many essential personnel have worked to ensure that our healthcare delivery system is operational. So in the spirit of appreciating sacrifices of people who have come before us, all the sacrifices that they've made in order to guarantee us health and safety and freedom, I'm not sure if the chat is active. If it is, I'd love if you all could type in some freedoms that you're feeling grateful for, even amidst this pandemic. So I should have asked before, but is the chat active? Is it viewable?
The chat is active and viewable, so
Wonderful.
folks should be able to. Yes.
All right. So you all are on. You thought you were going to hear from me. I want to hear from you. So please put in some answers to freedoms that you're grateful for amidst this pandemic. I'm watching. I don't see anything, but I know you guys are grateful for a lot. Oh, it's starting to move. So grateful we can meet here. Audit. Yes, very, very true. Being able to walk outside. Awesome. Get out and take a walk. Freedom to learn online. Yes. Access to healthcare. Booster shots. Oh, it's moving now. Nature. Oh my gosh. Grateful for increased access to mental health services via telehealth. Yes. Vaccinations. Ability to pivot virtually. Someone called out childcare and being able to meet despite the fact that you have family and other obligations. Your expertise. Oh, you're very kind. Let's hope I live up to that. Access to education. This is awesome, awesome, awesome. Keep it going. So I guess what I want to say is that I want to share what I'm grateful for. And I'm really grateful for the ability to engage in a conversation with you today. That in itself is a huge privilege that we, even amid this pandemic, can take for granted. When there's so much suffering going on in our world, to me, it's a privilege to be able to even just join emerging leaders like yourself and discuss what we can do to impact the world, even amidst a pandemic. So I want to specifically thank the folks who have put on this really amazing forum and this series that you're participating in for inviting me to share with you a little bit about my journey. And you heard that intro. I'm Leandra Clark-Harvey. I'm a psychologist. But I really want to share with you what the learning objectives are and tell you a little bit about who I am and what I bring to this space. So I represent an agency called CBHA, the California Council of Community Behavioral Health Agencies. And basically, we're a statewide advocacy organization that represents mental health and substance use disorder service agencies across the state. And collectively, our members serve over 800,000 Californians annually who have behavioral health, mental health, and substance use disorder issues. And so it's really my pleasure and my joy to be able to represent these folks and what they need and the needs of their clients at the state capitol day in and day out. So I really love the work that I do. I was trained as a counseling psychologist to either be a professor or clinician. Those were my options. My advisor would always say, which one are you going to pick? And I always felt uneasy, and I felt like I want to do more than just practice and just be a scientist or researcher. Those things are wonderful, but what else can I do? And that's really what led me to the space of advocacy. And I'm going to share with you in a little bit of more about my journey, what brought me here, what inspires me. So the learning objectives of today are very technical and good, and we're going to do all this, but I'm going to do it a little bit more informally through storytelling. So really, as you can see here, the goal is that you all understand the importance of intersectionality in your work, that you have a good awareness of how cultural humility impacts IBH practice, and then also start to strategize about how you can personally commit to establishing socially just practices in the work that you do or will do. So those are the goals, and I'm going to try my best to take you there. We're going to examine these goals and objectives through storytelling. As I said, I'll share about what brought me to the behavioral health arena, what inspires me as I work for an advocate on behalf of behavioral health professionals and the clients they serve. And I want to share that, much of it happened by serendipity. So I want to talk a little bit about this concept of serendipity for a second. with you. So on this side, I say, don't believe the hype. Everything in life isn't an accident. Instead, I really believe that it's the result of intentional preparation, be it academically, professionally, and it leads to an individual being kind of in the right place at the right time. We've always heard that saying, right? So today I'm going to share with you how this has played out in my life, in my professional path, in hopes that it impresses upon you the importance of, these two lessons. I'll tell my story as a journey, and I'll discuss kind of quote unquote what to pack in order to be prepared for whatever is going to come your way in your own journey. So if you're dialed in today, it's likely because you have an interest in working in the behavioral health field. So first, behavioral health is a term that encompasses both mental health and substance use disorders. For too long, we've paid attention to mental health without really recognizing that substance use, alcohol, drugs, etc., also impacts the same individual and sometimes simultaneously. So we're really moving towards a more integrated term, a more integrative approach to looking at mental health, substance use disorder, really a whole person focus, as you all are probably aware of. So I'll say that term often today, and that's what I'm referring to. Also, people talk a lot about, well, what does it mean to work within the behavioral health field? And as you all know, there's several options in terms of behavioral health occupations, which require various levels of training, as you can see on the slide. And there's multiple roles that behavioral health professionals can play. But most importantly, as you think about how you'll be applying your training in the practice setting one day, remember that no one works alone. Your career, your success with your clients can only happen, I believe, if you conceptualize it as a team sport. So this means that you need a team of personal mentors to support you. You also need a team of professionals providing what I believe is best practice, and that's integrated behavioral health care for individual clients. Again, really a nod to that whole person care notion that no one stands alone and no one's individual problem is truly isolated. Everything is there's intersection between so many different pieces of an individual's life, and that includes their disorders as well. So I'm a psychologist, right? And I have all this stuff that I do and I have done, as was said in the bio before I came on. But when I really reflect on early influences that led me here, I often will tell people this story about kind of how I envisioned my future when I was a child. And when I was a little girl, my mother, who was a counselor, told me that I could be anything that I wanted to be. And I really believed her. I took that literally. But the thing is, I couldn't figure out what I wanted to be. But I definitely knew what I didn't want to be. I didn't want to be a mental health professional. And that is, as I just shared with you, because my mom was a counselor and she had this private practice. And I remember, hearing about a little bit about the clients that she saw and the people that came to her office. And I always thought, these people don't live like me. They don't look like me. They don't live in my neighborhood. So I grew up kind of erroneously believing that mental health treatment was a luxury. It was not for the young, the poor, or ethnically diverse. And obviously I was wrong because here I sit before you today, a counseling psychologist, and my mother is super proud of that. But that was really, my belief based on where I came from and what I saw. So after, I completed my academic and my clinical requirements, I returned to Southern California, where I did my postdoc at UCLA. And at this point, I made a critical decision. UCLA had offered me a position at their hospital, but I declined it. And everyone thought I was crazy. And there's more to that story that I'm going to share with you shortly. Instead, I ended up moving to Sacramento. I took a 1-year fellowship at the state capitol because I really wanted to understand how government worked and how the system that was impacting my daily practice, how do all the pieces fit together? So when I got to the state capitol, I worked as a health policy staffer to a senator, while also working with the Senate committee, which oversees several of the licensing boards across the state, including all the behavioral health licensing boards as well. So just 4 months into my fellowship, the Senate offered me a permanent job, and I had student loans. So I said, okay. And then after 3 years working in the Senate, I was promoted to be a chief consultant in the California Assembly, the other house. And I was able to really set some history in place there. I was the first Black person. I was the first woman in this position and the youngest as well to be chief consultant. So I stayed there for about 3 years. And then I got a call from a mental health lobbyist and leader. And he's actually the person that authored Proposition 63. You guys may know it. It's the Mental Health Services Act, Rusty Felix. And he said, I'm leaving, I'm sick, I have ALS, would you like to replace me? And I said, no, thank you. And he said, just interview, I think it'll be a good fit for you. And so I said, out of courtesy, I said, okay, I'll interview, but I'm not interested in leaving the Capitol. And I realized that it was a great fit for me once I got there. So I bring this kind of wealth of training and experience working in both political policy and clinical settings, and a lot of, local, state, national board service, but really forget the letters behind my name and the work in the board service, because the most important thing that I do is take care of Edison and Lincoln Harvey. These are my 2 sons. And these 2 kids, they keep me on my toes. So obviously, family is important to me. I'm sharing my family with you today. And I'm going to share a little bit more about my family history and how that's really influenced my path, because everyone has a story. And I do believe that that informs what you do in life. So for me, I come from a family of strong faith and action. And I'll illustrate this by sharing a story with you right now. So many of you may be familiar with the story of Ruby Bridges. She was a 6-year-old girl who desegregated New Orleans public schools in 1960. But what you may not know, that is on that same day that she was desegregating that school, 3 other 6-year-old girls, they were called the McDonough 3, were also integrating McDonough 19 public school right across town. And one of the little girls is depicted here. She's in the top right with the big white bow. Her name is Gail Etienne, and she's my cousin. So I grew up with these stories of, bravery and pushing back against the system and fighting for others. And it shows up, I think, in the work that I do. And speaking of clinical work, and speaking of work, it was really the clinical work that I did, and I mentioned to you earlier in Los Angeles, that brought me to this advocacy arena. And so I made a career shift from practice and research to policy and advocacy, really out of sheer frustration. You see, my passion was working with disenfranchised populations, but I felt that my work was often stifled because these families I worked with really had to combat what we call the social determinants of health, otherwise referred to, in my opinion, as real life problems. They had to deal with those first before attending to their behavioral health issues. In fact, it was when I was working at UCLA at their Mattel Children's Hospital, I was providing treatment to families who had adopted children from the foster care system. Then that I realized that I really needed to find another way to serve these families. So the story is, I was providing in-home treatment to a family, an African-American family in South Central LA. I was in the bedroom of my client, who was a 9-year-old little girl who had experienced enormous, amounts of trauma throughout her life. And she was adopted by her aunt and uncle. And so in the middle of our therapy session, the lights went out, which was a little scary, but we realized quickly that, they hadn't paid the light bill, but she had a big window. So we moved closer to the window and continued our work. The next thing I remember is covering her on the floor. I was on top of her as we heard gunshots ring out. Minutes later, we got up and opened the door because there was a big commotion up front coming from the living room. Her uncle had burst in the door and was waving this flyer. It was as if the shooting didn't even happen. He was waving this flyer, and he was really upset because the after-school program that her cousins were a part of was announcing it would close down soon due to limited funding. So they were closing 6 weeks early. So I'm standing there thinking, wow, in the middle of trying to provide trauma therapy for this little girl and her family, we were simultaneously being traumatized by the realities of living in a poor neighborhood. So it didn't matter that I was well educated. It didn't matter that I was working at UCLA at a premier research and clinical institution. Individuals, families could not attend to their behavioral health because of real life issues. And in this case, it was poverty. And so it was stories and experiences like these that inspired me to leave clinical practice and to take a position at the state capitol, because I really just wanted to better understand the system that was keeping people from accessing the mental health care that they needed. And the truth is, if anyone deserves mental wellness, it's disenfranchised communities. But for many of these communities, there is a history of stigma and mistrust that's impeded wellness, really. So I want to just review with you quickly how the system looks as it pertains to diversity and health today, particularly health statistics. So um, when we look at some of the national statistics overall for diverse populations, we know that Black and Brown populations in particular experience, as you can see here, less access to mental health services. They're less likely to receive the care they need, more likely to receive poor quality care. And you also see that they'll delay or fail to seek treatment because of these factors and others. We also know that in particular, Black Americans are more likely to terminate their treatment prematurely. And then after they do get into care, oftentimes we see that they don't receive the best available treatments for specifically depression and anxiety. So all of this is concerning. And if you examine some of the Medi-Cal recipients within our state, you can see that 3/4 are racially and ethnically diverse, despite the fact that many of these populations, in this case on this slide, African Americans are highlighted, as well as Latinos, do not make up that same percentage within the population of our state. So that's problematic, that there's a mismatch here. And as this chart illustrates, Black and Brown populations really lead the way in rates of psychological distress and also unmet need. But what's interesting is that when you focus in on Blacks in particular, they don't have the highest rates of behavioral health disorders. However, when they experience a behavioral health disorders, the impacts are much more significant, going to the emergency room in acute crisis and distress. And researchers call this the race paradox. But why is this? Well, I'll argue that, for many, there's been a legacy of overt and covert racism within the healthcare delivery system, and that these cumulative experiences of racism have resulted in mistrust in the system and created this generational trauma and stigma that gets passed down. In addition, I'll say that structural racism has led to limited access to resources such as education, employment, healthcare, housing, and political participation as well. So all of this taken together contributes to health disparity and increased rates of mental health disorders such as depression, anxiety, dementia, you name it, the list goes on. And as we think about health disparities, right, and as we think about how they all play out, I feel like it's really equally important to examine how individual and structural racism fuels those disparities. And because racism and bias, which we'll talk about a little bit more in a second, are prominent and problematic issues in society, it's critical. It's vital that as helping professionals, we all become aware of how they work and how they can show up in seemingly innocuous places, because there are so many subtle behaviors, and often we don't recognize when our own privilege and implicit bias is at play. Importantly, these phenomenons, are ones that we're not born with. We learn them. And that's why as leaders, it's so important to engage in discussions with, do the self work, but also engage in discussions with your clients, with your colleagues, your mentors, whoever it is in your life, to move towards unlearning and re-educating ourselves. So I'm going to share with you this slide, and I really like it because it illustrates the different forms of racism and how they manifest here. So here you can see kind of these 4 different levels of racism: personal, institutional, interpersonal, and structural. And you'll see that the ones on the left are, highlighted as individual racisms, and the 2 on the right, institutional and structural, are part of kind of systemic racism. And I want you to stay with me for just one moment, as we walk through these and then talk a little bit more, hone in on one of the individual racism sections. So we see, there's the personal level racism. So these are your beliefs, your prejudices, your ideas. There's interpersonal, which is really how it shows up in your interactions with others. And then we know that there are things set in place, at the institutional level. And this is really the policies and practices, if you think about organizations, institutions, and structural, more public policies, even larger, systemic issues that you see play out. And stay with me one moment, because you'll see I've circled here personal racism, which is part of kind of this individual racism side of the chart. And one component of personal racism, another thing to call it, is implicit bias. And you may have heard of this. This has become kind of a buzzword, but it's a very, very dangerous thing. And it's gained a lot of attention in the past decade. And during this pandemic, we've seen it really rear its ugly head. And what's so dangerous are that these biases are activated involuntarily and without an individual's awareness, or in many cases, intentional control, because they reside so deep in the subconscious. These associations kind of develop over the course of a lifetime, beginning at a very early age through exposure to direct and indirect messages. And when people are acting out of their personal or implicit bias, they're not even aware sometimes that their actions are biased. And in fact, those biases may sometimes be in direct conflict with a person's explicit beliefs and values. So I'm a Christian, I'm this, I don't believe this. Yet you look at what just happened, you look at an incident that just happened, and it doesn't reflect at all the beliefs that you hold. And it can be really surprising for a person. That's why we have to do the self-work and pay attention to those incidents and really unlearn a lot of that. So I'm going to share with you an example or two. Here's one right here. So when this children's workbook was released, there was an outcry about this page, which if you look at it, I know it's a little fuzzy on your screen likely, but if you look at it, it depicts kind of the white kids or the lighter skinned kids as happy achievers, and the brown skinned children on the right as sad or angry. Now, when the publisher realized this, they immediately stopped production. They issued a statement to everyone indicating that this was completely unintentional. And they were in fact shocked that the assignment of faces to emotions played out this way. So why is this important? Well, when a police officer holds a belief that Black Americans are more likely to be guilty of crimes, that only thugs wear hoodies, and protesters just want to destroy property and loot, that's really going to impact the split-second judgment that he or she has when they get a call and they have to make a decision when they're dispatched to protect the public. When a healthcare professional has biases about, let's say, how poor Latinx families raise children, and they have to make a recommendation about where a child should live, those implicit biases can cloud judgment. It's real, it happens, and we have to do better. So racism and implicit bias is real. It impacts racially and ethnically diverse individuals in particular, and how they see and how they react to the world. So I'm going to share a little bit personally an example of that. So here's a photo of my family, my husband and my two boys. My husband, Charles, he's a licensed attorney in California. He grew up in the Midwest in a college town, Ann Arbor, Michigan. He went to great schools. We met in graduate schools. I have my PhD. Why am I telling you this? Well, many would say that we're privileged and successful. This is true, but we are still so hyper aware of how others see us, even more so now that we are raising two little Black boys. So less than a year ago, we purchased a new home, right? In the middle of the pandemic, that made sense. But through this home buying process, we've really been reminded of how bias plays out. So we were in a little bit of a bidding war over the house, and we wrote this heartfelt letter to the sellers of the house, but we were very nervous and had to have this conversation about if we should share our family photo. You know, our fear was that someone's bias would be activated and we would not get the house because of this, because we were Black. We even shared this with our real estate agent because we thought, oh, that's silly. We shouldn't, I mean, come on, look how far we've come. Yes, the stuff exists, but was someone really going to let race play out in the decision? And our agent said, absolutely. She affirmed that this is a valid fear to have and that we should not disclose, we shouldn't share our picture yet. And we didn't at first. after, getting into the bidding war and talking with the family, we decided to. And luckily, the happy ending is that we got the house. So this was my son, Edison. He was very happy. He wrote his own little letter. We typed it up that said, "Thank you for choosing us. Our hearts are overwhelmed with joy." But I guess I share that story with you because this was really a first world problem, right, of a privileged family. But there are so many people that have to think about the decisions they make walking into a store, what they wear, etc., on a daily basis. And those microaggressions and the impact of that, the cumulative toll of that, is really impactful on an individual. And so as folks that are in the helping professions, we have to think about that. We have to think about all that folks are bringing in and what that's like to walk into a mental health center that might say mental health center on the outside of the building. And I'll talk to you a little bit more and tell a story about that. But that's why I share that with you. So we had a happy ending, but many people do not. And their biggest problem isn't, getting a bid on the house accepted. There are much more real issues that resemble those social determinants of health that we talked about earlier. So we've talked a little bit about health disparities, levels of racism. I've shared a couple personal experiences. And now I want to discuss kind of some principles to keep in mind as you develop along your leadership journey and practice journey, namely the role that you play on an integrated and culturally responsive behavioral health team. So I'd like to introduce this concept of culturally responsive leadership. And I always say that this comes first. This is kind of the self-work that happens here. It's not so much a strategy, but this is more of a framework for organizing leadership practices that are aimed at enriching and affirming each person's culture in the workplace, right? So all of your colleagues. And leaders who operate from a culturally responsive framework seek to understand the sociocultural, political, historical context. Two, you'll see here they engage in what's called a distributive leadership style that's inclusive, it's transformative for others. And three, they take actions that really lead to equity and effectiveness through cultural humility and cultural confidence. So that's really the goal. The goal is to get here. And let's talk a little bit about the first component of this framework. So when you see it talks about the sociocultural, political, historical context, earlier, we discussed, the importance of understanding the history of racism and segregation in the United States. And we also discussed the impact of stigma on help-seeking behaviors. But how does this play out in modern day context? What does this look like? Well, an example I'll share is that in Oklahoma, there was a mental health agency that served LGBTQIA individuals, lesbian, gay, bisexual, transgender, queer, and questioning, intersect, and ally. It keeps growing. So I keep feeling like I have to update that. But they served youth in a milieu setting. So really a group-based social recreational services, basic needs assistance, like all types of whole person care there. Now, due to the types of programs and services they offered, and partly due to the population they serve, their landlord issued a 30-day notice of non-renewal. And this was pretty much a clear case of discrimination based on beliefs rooted in history and culture. So that's just a very clear example of how context can impact. The second part of this framework underscores the importance of kind of leadership practices. Specifically, what they're calling here is distributive leadership style that's really inclusive and transformative. So understanding now that the context is understood, how does one use their position and privilege to make change within the system? So it's really about the individual and what you can do if you're working within the system to make change. So the example I'll share is, just simply asking people what they want and need. So in the case of the Oklahoma agency, whose lease was about to be discontinued because of the types of folks that they were serving and services provided, what they did is that they interviewed staff and clients. They also, to get their feelings on the services that they provided, they also looked at how to diversify their board of directors. And they engaged in revisiting the mission of their organization with client and staff voices really informing the process. So yes, they had legal battle with their landlord, but they also started to look at internal practices as well as they serve this population. The third part of this culturally responsive leadership chart, it really focuses on utilizing what you learn from key informants and taking action together. So together, these components in practice can really strengthen an organization's ability to meet changing needs of employees and client systems. The example I'll share here is I used to work at a place called the Mental Health Center of Dane County. They changed their name to Journey Center. This was really important because many clients, after doing some interviews, and our clients, they didn't want to come to the center. They didn't want to come to that brick building that said Mental Health Center of Dane County. It was stigmatizing. The bus stop was right in front of it. Everyone knew where they were going. And so we quickly realized that a name can have so much impact on clients, and that we needed to be more culturally responsive in the services that we were providing. Other things that we did was we moved services to safe spaces and places in the community. So we had meetings, group counseling in church basements, community centers, places that folks can walk into, and it wasn't so clear cut where they were going or what service they were getting. And also it was more accessible for these populations as well. And we also empowered middle managers and clinical managers to create more support groups for the community to deliver care in different types of ways. So those are some suggestions, are some examples about how these kind of leadership styles play out in different places, whether it's the individual or it's the organization that's taking action. I'm going to stop here and open it up for any questions. I'm going to check the chat and see if there's anything that's come through. And if not, I'm going to encourage you all to write any comments or responses to what you've heard thus far, whether it's my personal stories or kind of the more systemic issues with the social determinants of health or a culturally responsive leadership model I just shared. Don't leave me hanging here. Tell me something. Are we on the right track? Is it making sense? Any questions? Don't make me put the Jeopardy music. I see your mic on, Tiffany.
Yeah. Sorry, I can't see myself now because I have you spotlighted. But one thing that we have a lot of, it seems like our audience is a range of folks in practice, and then folks who are currently in training. And I'm curious for you, as you think about maybe like the interprofessionalism piece, or sort of bringing like this anti-racist lens, bringing sort of these liberatory ideas, bringing that social justice work into some of the more like medicalized spaces. If you have any tips or advice you'd give to folks related to that.
Wow, be brave. I would say. And I have to be honest with you, people, I think, I can think of lots of, I've been able to be in a space now where I can affect change. I can do really neat things. I can create change, right? But that is a process, and that's not where everyone starts, particularly if it's your first clinical experience or your first few jobs. Yes, definitely be brave, push the envelope. But the reality is you've got to pay the bills too, right? So a lot of times it's really partnering with other allies, being a part of a team of mentors or colleagues who are like-minded to then push change, like go in numbers. Don't go alone all the time, because the reality is you've got to live, right? And you have to pay the bills, and you have to get your training and meet requirements, but you also have to feel true to yourself, right? And you have your own journey and purpose for where you are, and we'll talk a little bit about that in a moment. But I would say be brave, be true to yourself, but don't go alone. Don't go alone. Have an ally, have people that are like-minded, create a group, create a support group, find those people in those spaces and places that are going to support you in what you believe, as you really strive to be the professional that you're meant to be, and as you walk along your journey. I hope that answers your question, Tiffany.
Yeah, I think it does. And I don't know if you can see, there's a bunch that came into the chat.
Yes. Let me read through these. Here we go.
Yeah.
So I'll try to respond to a couple of yours, and then we'll move on. Let's see. Honest talk is good. Okay, good. Current questions. Let's see. Frustration can be such a great motivator. Yes, it is so true. And that's something I'll tell you too. Pay attention to what, are called, you may be familiar, critical incidents. So those things that really stand out to you, those things that like motivate you, fuel you, the things that make you angry, the things that you feel perplexed about, because it was those things in my journey, academically, professionally, personally, that helped me really make sense of where I was going, right? And what was next for me. So I love that someone mentioned frustration. the race paradox and how the rate of Black and brown mental health needs to open. Yes, and I will share the slides with you all too, so that you can see. I have links to the resources that I pulled information from that you can dive into deeper. So happy to share the slides so that you can get that information and do that reading, please, there, because I don't want to take up too much time there, but I do think it's important. So hopefully that'll be helpful. And feel free to also have my email address on the slide. So feel free to follow up directly if you have any other questions. Someone talked about the difficulties of doing more than just surviving each day when you live in an environment that is steeped in violence. Poverty is accurate. I personally lived it, but yes, it's so true. So again, think about I truly believe that there's meaning in everything that happens in your life. Earlier when I had, serendipity up there, nothing's an accident. Don't believe the hype. It's all coming together. I see in my life, all my experiences have come together to really, allow me to be in this moment, living out kind of my dreams. And so it's hard work. Yes, you have to put something into it. It just doesn't happen on its own, but there's reason for who you are, where you come from, where you're going, and figure out how to make that work as you tell your story, as you really actualize your life work. Okay, the slides and recording. Okay, great. So you guys are going to have those available. All right. So really happy to share any additional resources. I see a couple questions for resources. And hearing a lot of amens, I'll say, to working with families that can attend to their health and wellness. Yes, so those social determinants of health are real. And that's why it's so critical that you all really espouse the components of culturally responsive leadership, right? So yes, the context, your organization, where you're at, taking action, the individuals within it, taking action as well on behalf of the clients that need help. So I'm going to move forward. Thanks for that little break and that feedback. That is good. So let's talk about how you do that work. Here's some recommendations. And really, some of these are more at the system level. So some of these you may have an influence upon, and some of these you may not, based on your position. But, here are some recommendations for really how to start to transform systems that you're working within. One is, diversify, have more diversity in the workforce. Duh. Just on a plain face. Now we know that's not deep, right? That's just the presence of others, diverse others does not mean that that's the answer. But we do know that clients in race and ethnic concordant relationships do use services more often. They're less likely to postpone or delay seeking care. They do report greater satisfaction and better communication. But I would say the caveat is that depends on the treaters, the providers' level of cultural responsiveness, their own understanding. One thing that really used to surprise the clients that I would see when I was working in Madison, Wisconsin, is they'd say, "Oh my gosh, I want a Black therapist. There's my one Black therapist here." So they'd be happy. Okay, we got him. We have our session set up. And I would say to them, "What do you think it's going to be like working with me?" They're like, "Well, what do you mean?" "I think it's great, because you're like me, you're going to understand me." I said, "Really? I'm from California. You grew up in Madison, Wisconsin. I grew up here. These are my experiences. I'm working on my PhD." And I didn't say that to distance my clients up at all, but they would be surprised. And I said, let's have a real conversation here, because if you don't really feel that I fully understand your experiences, then we're not going to be able to work together. There's going to be no difference between me and whoever's up the hall providing care with you. Let's talk about our differences. Let's figure out what our commonalities really are. And so it really would open this rich discussion in the very first session that got us talking about social class and how those things play out in people's lives, perceptions, etc., across even geographic areas. And it in so many ways, that honesty and that kind of deep dive conversation at our first session helped to work through a lot of things that came up later on. Even if it wasn't about me and the client, it was about them and people that they were working with and interacting with. We really got a lot on the table there, and we're able to strengthen our relationship. So, diversity is great, but that cultural responsiveness, that cultural humility, that self-work, even if you're like, I look like that person, I need to do a lot of study here because I get them in their back. No, not all the time. So that was really, really important. And then also education and training has been proven to be so impactful. There's not enough. There will never be enough. And I think when you think about working in contexts where it's not just a behavioral health provider, but you're working with physicians and the school teacher and everything, integration is important, but everyone needs to have some common education around cultural responsiveness, around working with diverse individuals so that they can be optimal. The best work that I did as a clinician was when I worked on a team. I worked with the teacher, with the social worker, with the physician. Like we were all on the same page communicating around one client's need. And I'll have to say that that was a luxury because people don't always have that. You're not always going to have access to all those professionals, but it is important for you to try. It's important for you to try to make those connections. Go observe the kid in their school setting, talk to their teacher, talk to their social worker. Don't just stay confined to what you do in your office with them, weekly. It's so important to have that integrated approach. And that's not how people live. People don't experience life in a funnel. We just have this professional and this professional and this experience. It all moves together, just like behavioral health, substance use disorder, and mental health are all working together within the same individual. So just think of that when you are practicing and working with others. All right. Also, culturally responsive individuals really work hard to integrate care. We also know it's so important, like I said, just to train the workforce, but as we talked about earlier, understanding the impact of racism and how that plays out in the lives of the people you serve is critical. I mentioned to you starting the dialogue about difference, even in my first session, because it's real and it's there and it's unstated. And so it needs to be brought up in a really concrete way. And you're also modeling for the people that you're working with how to have those conversations with others outside your session. Something that just cannot be emphasized enough, which you all obviously probably know, is to really focus on the resilience. People have stories, they have experiences. And so wherever and whenever you can, be strengths-based, help other people on their care team to be strengths-based. It is so, so important. And then integrating cultural norms and traditions where it's really possible. So when I worked in Madison, Wisconsin, there was a large number of Hmong refugees because Madison was one of the settlement areas when people came over after the Laos war. And so we had to figure out how to provide services. So what did we do? We had a group that we wanted to establish for Hmong young women who had experienced lots of different trauma, but we knew we couldn't do it like we did most other groups, which was bring people in, big group room, sit in a circle, do our work. No, we had to go to the elders of each community, Hmong community, and ask permission that we work, and ask their families permission that we work with the young women. We had to humble ourselves. We had to put aside all of our degrees and ways of working and literally go into the homes and talk to the elders and let them know what we wanted to do. We had to eat with them, have a conversation, get the permission before the young women could leave the home with us and go to our group. And in the group, we did things very differently. We cooked rice and we cooked all kinds of other food. And then we started talking, and it wasn't just traditional therapy. We did it in different ways. We used a lot of different cultural artifacts and stories and healing, and they taught us so much. But I say that because integrating culture into your training and all of the modalities and manuals and everything is critically important for many populations. And so just want to encourage you to stay open to that as much as possible. Also, including family and community, right? So not just partnering with integrated, behavioral health professionals as well, but with community allies. So I've had an instance where I worked with pastors or shamans or whoever represented the culture that my client was involved with, and whatever was important to them. We integrated that into treatment. And when providing, so often we think when we're providing help and resources, we should be providing it to the individual client and their immediate family, but really thinking about providing support also to the caregivers. Caregivers are so stressed. They do so much and they also need help. And so whatever we can do to have a fully comprehensive approach to treatment is important. And it's also important to provide information on long-term care and supportive services, particularly when working with older adults and families as well. Not just what's going to get you through the moment, but what do those supports look like that may not be a mental health or substance use disorder support. It might be something to support them with their physical health. But again, it's about integrating all of that to help them be healthy overall. All right. I also wanted to share this slide because it really gives a nice framework for what's called excellence in mental health and well-being. And this is created by the Wellbeing Trust. And so they talked in this slide, you can see so much connected here, really what's happening at the community and how that can impact and be a barrier. You know, you see stigma and the dark blue line going down, social isolation. And we saw a lot of this with the pandemic. And then in addition, you see if someone doesn't have good coverage, affordability, comprehensiveness, parity in terms of healthcare and treatment, what can happen? It can impact engagement. So this is really like utopia, that you have these vital community conditions. People are thriving, they have belonging, transportation, lifelong learning, that these barriers really aren't able to kind of impact significantly. Then there's affordability, comprehensiveness, parity, you see engagement of the health system, everything's kind of connected and integrated, right? And then what are the outcomes here? You have improved community conditions. So again, we're talking about these social determinants of health. You have increased affordability, advanced integration. All of this comes together. So I say that, is it utopia or is it a possibility? I do believe that as we continue to do our work, as individuals continue to educate themselves and others, that you can make this a possibility. Are we there yet? No. Do we have a long way to go? Yes. However, I really like that they kind of mapped out how when things work ideally, this is what a system should look like. And your job is really to figure out, where do you fit in? Where are you in this picture? How do you help move this forward? And you see it's kind of an arrow moving, and that's why. All right, what else do I have for you? Wanted to share this depiction because I really do think that the goal of the work that you do, the goal of your passions really is to get to a place of equity. And oftentimes we strive for equality, right? That's really this whole like evening the playing field notion. But I really think you have to recognize that not everyone shows up to this, you know, in this case, a soccer game with a field with the necessary equipment, meaning that nothing is really ever even or equal. You know, a few months ago, I was on a flight with my children and I was told, in case of emergency, you know, put your mask on first and then assist them with theirs. And I really want to challenge you as leaders, as emerging leaders in your respective workplaces in your field, that do your own work. Do your own work. Put your mask on first, and then help your colleagues by taking really decisive steps towards impacting this racial pandemic. And a first step can be opening a dialogue about what's happening to you in your world and how that's really impacting the work that you're doing day in and day out. So I'll bring us back to this notion of serendipity. Nothing past my postdoc was planned. It wasn't. And as I reflect my thoughts about, you know, kind of mental health careers when I was a child, changing my major in undergrad, leaving UCLA to work at the Capitol, and now leading a statewide advocacy organization, it's really confirmed that serendipity has been at play the whole time in my life. So as you prepare for your future, I would say do everything in your power to educate yourself, prepare, right? But know that your path will take the shape that it's supposed to. And it will likely look very different than you planned or imagined. So I'd like to share that, you know, regardless of your destination, everyone needs to know what to pack, because I think it's best to be very prepared for a journey. So I put first, you know, practical skills and experience. So that's really like the underwear, the toothbrush, the deodorant, the necessities, right? So those would be strong writing skills, critical thinking, analytical skills, leadership, experiences, advocacy. And this can look like service in your workplace, your graduate program, your campus, your state psychological association. I also think it's really important to articulate who you are. So have an elevator pitch that may be needed, you know, when you go to network and to conferences. Know how to explain who you are, where you're going. And that takes some thinking. Also, vision is really important. I say this is the ability to this is you needing to know where you're traveling, where are you going, where's your vision? Because in order to do this, you really need to embrace some of the critical incidents and dilemmas that I think someone in the chat was saying, you know, what frustrates you can really fuel you. Yeah, pay attention to that. Take note of that. Remain curious, pay attention to what excites you, angers you, fuels you, because that's likely linked to your passion and where you're going to feel fulfilled in your life and in your journey. I also think it's important to have a mission statement and to stay true to it. So I put on the slide, no time for frivolous excursions. What I mean by that is that everything that you do should really have purpose and meaning and tie into your mission, right? The statement should reflect your values, your passion, who you are, who you want to become. And so I'm going to share with you mine. I wrote this years ago, but it says, everything I do is done with passion and purpose. I'm a leader, clinician, and advocate for those who cannot advocate for themselves. I'm an expert mental health professional dedicated to eliminating mental health disparities. I deliver excellent work products that impact the lives of others in a positive fashion, and everything I do is reflective of my underlying passion and values. So I wrote that, I think, early in my grad school, but it was something to return to. And as I decided on things to involve myself in, on projects to pick up, I thought, how does this fit into my mission? Is this a part of where I want to go? Is this going to support it or be a distraction? I also think that something that's so critical is to seek out mentorship. And I say here, others can help you pack and carry your bags. You know, who you choose as a mentor is so critical. It's a critical decision. I've seen a lot of people make some interesting mistakes here, but first they must want to mentor you. I've seen so many people just say, will you be my mentor? Not really understanding what that means, not really understanding a person's capacity. The individual needs to be invested in your personal mission. You might even share it with them. They must be willing to keep you accountable to your mission as well. And some people don't have the time, energy, or desire to do that. So it's important to also discriminate who you share your mission, who you share your dreams with, because not everyone needs to know. Some things should be kept close to your heart until they mature and you have a better understanding, or only shared with those who believe in your dreams and are really willing to push you further than you thought you could go. So I'll share a quick story. You all have heard a little bit that, I was trained as a counseling psychologist. I, worked in community settings. And then when I came back to California, I was practicing at UCLA. And at that time, that's when I told you a story about the little girl and feeling frustrated and like I needed to understand the system better. Well, one of the first things I did was I sent a note to one of my mentors because I Googled policy experiences for psychologists. I thought, I don't know, let me see what comes up. And I found this internship, and it was for a year fellowship at the state capitol. But when I looked at the people that had been a part of the internship, they were all natural scientists, biologists and chemists and whatnot. And I thought, oh, they don't want a social scientist like me, a behavior scientist. There's no way. But something told me to just send it to my mentor, who I had confided a lot in about, what I wanted to do. And she works at NIH and she does really amazing stuff, but she's trained as a counseling psychologist. She wrote me back immediately and said, you have to apply. This is you. And I thought, well, no. And I started telling her all the excuses why it wasn't me. And she said, just trust me, apply. This has got your name all over it. All right. And I ended up getting the fellowship. I was the first social scientist that they led in the program. And as you've heard, my career just took off, right? I was employed very quickly at the Capitol, and all of it has all come to pass. Why I tell you that is it's so, so important for you to trust the people that you trust your mission with. It's important to have a mission. And oftentimes there are people that can see things that you can't see yet about yourself. She could see that this is right for me and this would open up a lot of doors and whatnot. I was still stuck on the fact that I didn't see someone that looked like me in terms of professional background in the list of, folks that had gone through the program. So, all right. So I love quotes, and I'm going to leave you with a few. I like this one. This is encouragement for your journey. Not I nor anyone else can travel that road for you. You must travel it by yourself. It's not far. It's within reach. Perhaps you've been on it since you were born and you don't even know. So keep it up. Keep moving in the direction you're going. And then this one, your journey has molded you for the greater good. And it was exactly what it needed to be. Don't think you've lost time. There's no shortcutting to life. It took each and every situation you've encountered to bring you to the now, and now is right on time. So oftentimes people will say, oh, this has happened, or I wasn't prepared this way, or I should have done this, or I should have had this experience, or I lost time here. No, you're where you need to be right now. And so I'm really excited for where you're going to go. I'm excited for this series and all that it's going to expose you to. And just grateful that I had the time to share with you a little bit about my journey and how my path has been shaped. And I'm happy to check in and have discussions with any of you offline if you want to talk more. all in there in interest of time. I hope that I didn't go over too much. I'll kick it back to the moderators, and I'm happy to answer any questions.
Yeah, you didn't go over too much. We've only got about a minute left though, so that's probably not a lot of time to answer the big questions, but that is good because you did that previously. So yeah, if you want to, like, you're getting a lot of thank yous in the chat. There were some questions about how working in legislature influenced you and some questions about ableism that sort of came up in that. But like I said, we've got a minute left, so I think we're going to wrap here. And thank you again so much for sharing about your journey. I think Christina is putting in the chat for what folks need to do to sign out and get your CEU credits, or HRSA stipend recipients as well. And I think somebody already put in the chat, but yeah, we've got 9 more of these coming up. Each speaker is going to address a different aspect of IBH and how we bring this sort of culturally responsive. I love that focus on the leadership model that you did. How do we bring this to the work that we're doing? So thank you.
I'll just say quickly on the ableism, I think it's obviously so important. And I think for today, I was talking more general when I talk about diversity. When I talk about cultural responsiveness, it really does, in my mind, include all of those different aspects. I'm a Black woman, right? And a lot of my work has been focused on working with racially and ethnically diverse populations. So that shows up in how I convey some of my experiences, but fully recognize that there is so much more we can delve into. This was just an hour. So I'm not ignorant to the importance of addressing that. But thank you for bringing it up. So important to remind us all.
For sure. Yeah. And I think one of the 10 will be specifically focused on looking at the way that disability justice and all of that comes into play in this. So for sure, digging into that further. So thank you again, everyone, for coming. Thank you again for your time. We're really appreciative of you all. And yeah, go ahead and click the links to get for your CEU, etc. And take care, everyone. Have a very good day.